Hello. For those of you who don't know me from my newsletter or blog posts, my name is Paula Umel and I'm a functional medicine registered nurse. So just a little bit about me so you aren't wondering who's this person giving me this advice. I am a functional medicine registered nurse. I am a yoga teacher, a Reiki energy medicine practitioner, an herbalist. So I practice natural medicine basically and I have the biology, anatomy, physiology perspective of a Western medicine trained registered nurse. So I have a blog post that I'm going to be putting this video into that is about preventing and taking care of yourself with viral illnesses. And this is for colds, flu, COVID-19, all of it. So 3 things that I want to talk about today are breath work, spinal movement, and there was another one. I'm forgetting what it is right now, but I'll remember. Anyhow, so breath work. Breath work is, I'm sitting in a chair, so this does not have to be something that you do standing up. You can do it sitting in a chair, and I'm going to do everything sitting in the chair, but you can do it standing up. You can do it lying down on the floor, on your belly, on your back. Breath work is something that is like the foundation of natural health, whether it is energy medicine, yoga, I don't care. Our breath coming into our body is what fuels our lungs to have the air, the oxygen that we need that moves into our circulation to bring oxygen and nutrients to every body cell. So most people have very shallow breathing habits. So one of the important things that you can do for upping your immunity and staying in a good mood in trying times is deep breathing, really deep belly breathing. So when I mean deep belly breathing, I mean expanding the belly out with the breath so that your diaphragm drops down and it allows your lungs to be able to drop down as well, so that you're expanding your breath outward, your chest expanding outward with the breath, your lungs expanding downward with the breath. And really breathing deeply so that you feel your rib cage expanding out to the side. You feel your lower rib cage, your middle rib cage, and up here. Most people, when they breathe, never breathe deeply enough that they feel this upper rib cage actually moving. So really deep breaths so that the lungs are expanding to the sides, to the front, and out to the back. Really feeling that rib cage being moved. And practice deep breathing several times a day. Any breathing activity that we do in yoga is always deep, slow breathing. So, well, not all. There are some definite breath work that's, faster and that sort of thing. But I'm more of the slow flow and breathing. So deep breathing, it opens up your lungs far more than the average shallow breathing that most people do. So you're opening up your lungs to move clean air in and then metabolic waste, old air out, aerating all the cells in your body better. And when you do this deep breathing on a regular basis, several times a day, you are strengthening your lungs so that when your lungs have to deal with something like a viral illness, they will move through that viral illness in a much healthier and expedited way because your lungs are healthier. And so you will be able to breathe better even when your breathing's compromised because you're coughing, you've got congestion in your lungs, etc. So you really want to be practicing that deep breathing all the time. The other thing deep breathing does is we have this nerve that comes down through the center of our body. It's called the vagus nerve. And when we practice deep breathing and the spinal movements that I'm going to teach you, yoga poses, we stimulate that vagus nerve. And that stimulation of the vagus nerve through deep breathing, yoga poses, spinal movement, even mantras and chanting. When we stimulate that vagus nerve, we tone it. The vagus nerve is part of your parasympathetic nervous system, and the parasympathetic nervous system is what keeps you in rest and digest mode. So it keeps you calm, in the moment, handling things from a space of cool collectedness instead of emotional reactivity and freaking out with anger, frustration, sadness, grief. So we keep ourselves well grounded in peaceful rest and digest mode. So deep breathing and these spinal movements I'm going to show you. So most of us sit slumped over our computers or our phone, and our spine is not in the good posture that it's meant to be in. So simply sitting in really good posture, extending your head up so that your whole spinal column is pulled up with you. And then you can feel how you're opening space in between each one of your vertebrae where the discs are. So you're giving your discs the break, you're opening up that spinal column, and you're allowing nerve impulses to be better able to move off the spinal column because they're not being squashed right now when we're sitting slumped like this. So good posture, spinal extension opens that up. In opening up spinal extension this way, we're also stimulating the vagus nerve. We're also stimulating our body's energy system. So the electrical energy that flows through your body flows more freely, unimpeded, and that's part of keeping you healthy, the flow of life force energy in your body. So it helps to keep your immune system functioning better so that you are able to prevent and get over illnesses much more easily. So spinal extension. The other thing that you want to do with your spine is forward folding. So it's simply bending from your hips. I know you can't see my hips right now, but they're down here. Not from the waist, because when you bend from the waist, you'll notice, I don't know if this, that you see the back out. So you make this C formation with your lower back, and that pushes your discs out. You don't want to do that. So no bending from the waist. When you bend forward to fold your spine elongated over your lap, or in a standing posture to bend forward, I'm back. You want to do it from the hips. So a daily routine a few times a day would be to sit down, take several slow deep breaths, and then practice elongating the spine, keeping the shoulders down, relaxed and calm, forward folding from the hips, and then you want to do some back bends. So from a chair to do a back bend, I've got my feet wrapped around the legs of the chair for a little extra pull, and then just lifting up and lifting the chest forward from your sternum, from your heart space, lifting up so that you're bending your spine backwards while deep breathing slowly and making noise, letting that breath move noisily through, in and out as you breathe. And then again, using your legs on the chairs, and you can do this standing up, but using your legs to ground yourself on the chair, a spinal lateral bend. So we're going to lateral bend to, I'm going to the right now, and hold it for several slow deep breaths. So see, you're getting more deep breaths in here as well. Several slow deep breaths. And then coming up and repeating that on the opposite side, lateral bend. So when you lateral bend, you lift the body's carriage, your spinal extension, before you then tip to the side. And it's a bend of the spine. You're not letting your whole body move over. You're bending that spine, opening the spaces between the vertebrae, and then bending sideways. So we've done spinal extension, we've done forward fold, we've done back bend, and then we've done the lateral bends to either side. Again, grounding your feet on the chair legs to hold you in place. Now to do a spinal twist. So a spinal twist lifts the spine up again, extending it, and you're moving your body in a twist either to the right or the left. And if you have a chair with a back on it, you can use the back of the chair to help yourself move. But when you do that twist, you want your spine extended so that you're not grinding your bones together. Nice extension, and I'm going to go to the right. So it's just lifting and looking out over your right shoulder. Feel that twist in the spine. Feel the twist of your torso. And take slow, deep breaths while you're doing this. No holding your breath. Slow, deep breaths. And then come back to center. And then repeat the same thing on the other side. So lift up, extend that spine up so there's juicy space in between your vertebrae, and then turn and twist to the left. I'm putting this hand on the outside of my left thigh to push, and my left hand is behind my back. And it's just lifting up and twisting while deep breathing slowly and noisily. So that just gives your body, you're twisting your torso. It's like twisting the dirty water out of a dish rag, and then you can bring in clean water. So you're twisting your body, you're twisting out the old blood in your organs to bring in new blood, new oxygenated blood from your deep breathing. You're twisting out lymph fluid. You're twisting out your body's life force energy. And then when you come back to center, all this new energy, new blood, and new lymph fluid is flowing in to your internal organs and just livening them up, which is good for the immune system. It's good for your mood. So that's my advice. Deep, slow breathing for the lungs. And then the extension, the forward folding, the back bending, the lateral bending, and the twisting of the spine. Deep, slow breathing. There was one other thing, and I haven't remembered what it is that I wanted to tell you. So these techniques will enhance your lung function. They will enhance your immune system function. They will enhance your mood so that we can practice staying grounded in the present moment and happy instead of frustrated about what we can't control in the past or frustrated what we can't control, not knowing what's going to happen in the future. Staying present in the grounded moment right now and taking care of self so that you be healthy, so that you can take care of those around you, your family and friends that you are in contact with. So thank you for being here. Deep breathe. Namaste.